Great. Good afternoon, everyone. Hi, how are you? Welcome. Welcome to the OJJDP Tribal Youth Training and Technical Assistance Center webinar for the Tribal Youth and Substance Use Session 1 of a two-part series addressing tribal community youth strengths and needs. Welcome. Thank you very much for joining us today. And my name is Courtney R. Holler, and I am Sac and Fox, Pawnee, Otoe, and Creek here in Oklahoma City, Oklahoma, housed out of the OJJDP Tribal Youth Training and Technical Assistance Center with the Indian Country Child Trauma Center. So as we begin, I'd like to welcome you and thank you for joining us today. And as we'll welcome our presenters that we have from Mr. Evan Elkin from Reclaiming Futures, and we also have a presenter from the SAMHSA Tribal Training and Technical Assistance Center, Mr. Cipriano Lucario. And so as before we get to them and before we get started, we wanted to take a moment and ask each and every one of you to type into the chat and tell us who you are, where you represent, the community you're representing, and of course if you have anyone else, any other colleagues in the room joining you. That way it'll give us all a sense of who else is joining us and how far we are reaching today. So, and before we go any further, as you begin to type in and begin to watch that, I'm going to turn it over to Mr. Nicholas Birdshead, who's going to walk us through some housekeeping. So I'm glad to see everyone participating here and sharing where they're from, sharing which communities they're representing and the work that they're doing. We thank you. It looks like we are reaching across the miles, and we have people joining us from coast to coast. And so it looks like we have a really good group with us today, and we're really happy that everyone is able to join. So one thing that we like to do, and I believe it's held in high respect across Indian country whenever we gather to share information or come from all different directions, we try to start in a good way. And so that's what we're hoping to do here today. And I wanted to offer these words of encouragement and these words of acknowledgement, if you will. This is called In the Circle Way, Teachings of the Spirit. And this was actually brought to us and contributed from Dr. Dolores Subia Bigfoot, the director of the Indian Country Child Trauma Center. And this is collected through knowledge and wisdom through elders throughout Indian country. And so we share this to acknowledge your presence. Know that you are sacred. Know that you are honored. Know that you are prayed for. Know that others gave offerings in your behalf. Know that you are not alone. Know that you were known before you came to this place. Know that you have choices. Know that you have a name. Know that many know your name. And know that when you reach, you are also reaching towards others. So again, we thank you for your presence. We thank you for all your good work that you do. And we're happy that you're here to join us today. So at this time, I'm going to turn it over to another presenter that we have here at the OJJDP Tribal Youth Training and Technical Assistance Center, Ms. Anna Clough, who is going to walk us through today's agenda.
Hello, everyone. Thank you so much for joining us today. My name is Anna Clough, and I'm the Assistant Director here at the OJJDP Tribal Youth Training and Technical Assistance Center. And I'm just going to quickly read through our agenda for today. We've already done a couple of introductions, but we'll get more specific introductions later with our guests. We're going to talk today about prevention, intervention, and wellness initiatives that are efforts by OJJDP and the Tribal Youth TTA Center, the efforts that we support throughout tribal communities across the country. We're going to discuss public health and the understanding of adolescent substance use. And then we have a guest presenter from the SAMHSA Tribal Training and Technical Assistance Center that's going to talk about some resources and information that may be helpful to your community. And then at the end, we will have time for questions and closing. So that's a quick overview of the agenda. And what we hope to accomplish today is a discussion of public health and the perspectives of supporting tribal youth through treatment and options to serve youth within the justice community, and then also prevention and intervention initiatives. We hope that you learn about opportunities to strengthen your community through approaches that will serve tribal youth and empower them. And we want to talk about culturally competent resources and programming efforts that are available in Indian country and how to access some of those resources. And so I'm glad to see many of our tribal grantees have joined today, and then other partners that we have. And so thank you for joining us, and I look forward to our discussion today. And with that, our presenters today are Courtney Yarholer, who's introduced himself. He works here at the OJJDP Tribal Youth Training and Technical Assistance Center. Myself, Mr. Evan Elkin from Reclaiming Futures, and then Cipriano Locario. So I'll pass it back over to Courtney.
Thank you very much. Nick, if you can give us our first poll. What we like to do is, before we get started, I'd like to present a poll and get a little bit of interaction going. So we ask each of you to partake. And our question for today as we start off is, what is your level of knowledge of today's webinar topic? And again, that topic being tribal youth and substance use, addressing tribal community youth strengths and needs. And so we see the results coming in, and varied results. We know that from no knowledge to we have some with expert knowledge, and that's great to see. And it looks like we have about 75% around some knowledge. So that's great. That's great. So I think we all have some ideas. And so we certainly hope that as we go throughout the presentation here today, we'll be able to learn some knowledge and take some things away from this presentation and back into our communities. Okay, so I'm going to give it another 5 seconds, and then there we go. All right, well, thank you for participating in our poll. And I am going to move on over and just introduce the Training and Technical Assistance Center, the OJJDP Tribal Youth Training and Technical Assistance Center. I've mentioned it a few times already, but we are hosting today's webinar, and we're hosted here at the Indian Country Child Trauma Center, which is located at the University of Oklahoma Health Sciences Center in Oklahoma City, Oklahoma. Our contact information is here on the slide with our email as well as our website. If you haven't visited our website, it's tribalyouthprogram.org. I'll show you a slide of that, what that looks like in here in a few minutes. But I'll tell you a little bit about what we do and who we support and how we do our work. Excuse me, I have something in my throat. So, pardon me. What we do is we seek to support tribes that are seeking to prevent and control delinquency and improve tribal juvenile justice systems. And currently, we also provide training and technical assistance to tribes that have grants from OJJDP in the following purpose areas. That is Purpose Area 8 and Purpose Area 9. Purpose Area 8 focuses specifically on the Tribal Healing to Wellness Courts, and the Tribal Youth Purpose Area 9 focuses on tribal youth programs. And the way we like to explain these is that the tribal youth programs really focus on prevention and preventing our young people from entering into the justice system. And the Tribal Healing to Wellness Courts really work with the courts to work with the youth that are already in the juvenile justice system and helping them return to the community. So we provide training and technical assistance around programming needs that they may have. And we do that by supporting the grantees, by identifying and share culturally appropriate resources and information. We emphasize the integration of trauma-informed justice approaches, recognizing the impact of trauma on the lives of many of the youth that are involved in the justice systems. And we relate prevention and intervention approaches. We also coordinate resources and support for the OJJDP tribal grantees, as well as non-grantees and tribes and people that are doing work within Indian country related to juvenile justice. We can also offer training and technical assistance for them as well. So what we hope to reduce the number of youth in juvenile justice systems and reduce youth re-traumatization by the juvenile justice system. I wanted to show you a snapshot of our website. Again, the URL is tribalyouthprogram.org, and you go there and you will find an array of resources available for your programming needs. And we have trainings and webinars. We have a calendar of events. We have very specific resources that we're developing for tribal grantees. So those of you that are OJJDP tribal grantees, we have very specific resources that we consistently keep up to date. And we just try to do the best that we can to share relevant resources and stay above the trends and get the relevant resources available to you. So that's a little bit about who we are as a TA Center and what we do. So now, focusing more on today's topic, I wanted to begin by introducing and talking about our juvenile justice systems. Juvenile justice in Indian country and its current state. And these are just highlighting a few things that we know in the current state of Indian country, juvenile justice within Indian country. We know that there's a tangled web of federal, tribal, and state jurisdiction, definitely complexities that are not faced by other youth and that are non-native youth. The juvenile justice system in Indian country is even more disturbingly broken than its adult counterpart, and this was taken from the Indian Law and Order Commission report of 2013. And it's partly due to the tangled web of federal, tribal, and state jurisdiction, as well as a host of other complexities that our Indian youth face. We may mirror Western-based models that emphasize punishment rather than rehabilitation, and additionally lack of options for alternative processes. And so again, that is the need, I think, that we see for our Healing to Wellness courts and these different processes that we're working on, because we recognize that these Western-based models are not necessarily appropriate for our young people within the justice systems. Additional challenges that we face with juvenile justice in Indian country is a lack of cultural and trauma-based supports that further disconnect youth from the tribal communities and the tribal cultural experience. And we know that that disconnect from tribal cultural experience in our tribal communities is a huge risk factor for many of our tribal youth. And so we know that that's a challenge. We also know that there's a growing body of research indicating that making cultural adaptations to programs can improve the youth outcomes. So again, we're building that body of research and knowledge to support that tribal knowledge and cultural experience is a protective factor. We've also found that Native girls have the highest rates of incarceration of any ethnic group and are nearly 5 times more likely than non-Native peers to be confined in a juvenile detention facility. So again, these are some major challenges and highlights that we see that raise red flags, that call us for action. So trying to understand the risk and behaviors of our American Indian youth and how these numbers are impacting our juvenile justice system. First, we have to look at the high rates of related behavioral health concerns across Indian country. We recognize alcohol and substance uses, mental health disorders, suicide, violence, behavior related to chronic diseases, trauma, intergenerational and present trauma impact on tribal youth. So again, recognizing that all of these environmental aspects and all of these behavioral health concerns, or these concerns, how they contribute to these high numbers of youth in our justice system. In our research, we find that American Indian youth engage in binge drinking and use substances like marijuana and opioids at higher rates, as well as at earlier ages than their non-Native peers. Also, our youth living on reservations report significantly higher rates of substance use than national rates in non-reservation locations. So that's definitely a red flag. is although that American Indian Alaska Native youth substance use is higher, reservation-based American Indians consume less alcohol less frequently than the U.S. populations. So that also leads us to recognize and understand that other substances besides alcohol is being used, and definitely a cause of concern. And again, in terms of risk and behaviors, the lack of nonviolent coping skills coupled with substance abuse also places individuals at higher risk for acting violently, which can lead to youth being in the juvenile justice systems. So I want to stop right there and turn it over to ask Anna Clough to take us through the next few slides.
Thank you, Courtney. So I know that we've discussed some of the information that we know and some of the things we know that are occurring in our tribal communities, and I think that's why the TA Center staff and those of you that have joined today, I think these are the groups of individuals who, yes, we recognize that there are some abysmal facts coming out of the factors that impact our youth, but at the same time, communities are actively working to address these issues and working together to identify ways to intervene and prevent some of the behaviors that are related to delinquency and substance use, and as well identify strategies to provide programming and support to youth who don't have that support at home or the support from their families and their communities. And so we have definitely identified some ways to make an impact, and I think that OJJDP has provided some awards to many communities that are trying to initiate interventions in their communities, and so that's why the TTA Center is here, to support those efforts and to encourage communities to keep working toward developing programs and interventions that are going to help our tribal youth. And so one of the ways that we look at how to develop a prevention or intervention program is looking at the unique circumstances of our tribal communities. We've talked about these settings that we have, which are the complex relationship between the federal government and tribal communities, as well trying to work with state partners to really formulate programs that make an impact and reach across the spectrum of jurisdictional challenges and barriers, as well as the historical impact of trauma. And so additionally, we know that intervention and prevention programs within tribal communities may need to focus on intervening at an earlier age because we see that tribal youth, unlike other minority populations, engage in the use of substances at earlier ages than their counterparts. As a TA Center, we like to support the focus on restorative and traditional approaches within the developed programs. And we know that these approaches are specific to each community because each community has specific ideals, traditions, ideologies, foundational stories, and elements that speak to the programs that are going to be developed. And one of the major efforts by OJJDP has been the increase in tribal juvenile healing to wellness court funding and programming availability. And for those of you that are joining today that are working on a wellness court project, you may already know that the wellness court is a unique process. It's transformative, it's youth-focused, and it's really more about an individual case process that promotes youth accountability, community support, and the integration of tradition and treatment as a healing process. And so we have several of the resources through our TA Center that are specific to the wellness court. And if you're interested in learning more about those, we have several archived webinars and then materials on our website. And today we're just touching briefly on what the wellness court is, since we have other things to cover today. Tribal youth programs focus on prevention and intervention, and we focus on cultural connectivity, motivating youth to change behavior, It's community focused. We look for opportunities for tribal youth and look to the responsibility to be a community member that contributes to a safe community and not one that engages in substance use or delinquency. And the Wellness Court, as I said before, is a court intervention that involves tribal custom, justice processes that are team-oriented and non-adversarial. They focus on youth accountability and provide goal-oriented plans, and they work to provide a therapeutic environment that increases connectivity to culture, the community, and provides guidance for the youth as they work through the case process. And I think the Wellness Court focuses on what's important to that specific community. So no tribal juvenile healing to wellness court is going to look the same across the board, but there are a collection of resources and principles that we know have worked in the adult wellness court structure. And so as part of the resources that we have at the TA Center, our handbook does focus on the tribal 10 key components for wellness courts, which have been implemented in the adult setting. We've tried to adapt those along with resources that we know are specific to tribal youth to provide a guide for communities that are interested in developing a wellness court and for those tribal grantees that we're serving. And if you're interested in that handbook or more information about that, you can visit our website. It's available there for download, and the TA Center is available for consult or support if you're interested in learning more about the wellness court. And so today what we wanted to do was invite a guest. Evan Elkin is joining us today from Reclaiming Futures, and I'm going to take a little bit of time to introduce him. We got to know Evan through his work in the juvenile drug court setting and then also working with some tribal communities. And so we wanted to invite him to share his work and some of the things that he's learned along the way being involved with the work that our communities are doing, and we're really happy he's here. I want to read his bio real quickly. Evan is the Executive Director of Reclaiming Futures, and he is a respected innovator and leader in the field of juvenile justice reform, adolescent and family mental health, and substance abuse treatment and youth development. He's a trained psychologist from New York University and was a researcher at the New York Psychiatric Institute and Columbia University's Department of Child Psychiatry. He has worked for the past 2 decades and been at the intersection of public health and social justice, focusing on the nation's most vulnerable populations. He has worked extensively in tribal and non-tribal youth justice settings, schools, and child welfare settings. He helps to advance public health, equity, and social justice through innovation and the development of evidence-based practices. And so we're really grateful that Evan's joining us today, and we're going to let him share about the public health perspective on tribal youth substance use.
Thank you, Anna. Great to be here. I just want to express my gratitude to the Tribal Youth TA Center and to Dr. Bigfoot, who I connected with about 1.5 years ago. And our collaboration with Anna and Courtney and Dee's group has been really gratifying for me personally and for the organization that I run, Reclaiming Futures, which some of you may know about, most of you may not, from this particular community, and a very impressive group I see joining today, and from all walks of life, and a very multidisciplinary group. So it's really a pleasure to be here. So I'm going to jump in. I think I have control of the slides here. So do we have another poll we're going to do first, Anna?
Yes, and Nick will pull that up.
Okay. So while we're pulling that up, I just want to say that Reclaiming Futures has been around for about 20 years, and we were originally founded by a foundation called the Robert Wood Johnson Foundation, which you may have heard of mostly as a health and public health foundation. And 20 years ago was a time when there was a lot of interest in kind of unpacking some of the risk factors and major gaps, canyon-sized gaps in the juvenile justice system in terms of understanding and providing for the treatment needs of the young people that touch that system. So Reclaiming Futures was built to try to bring a public health lens to the work. So I'll sit back and watch folks kind of chime in about their understanding and experience with a public health lens. It looks like we have Most people are at least somewhat familiar with what we mean when we talk about public health, which is awesome, and some that are very familiar. So I encourage you, there's a Q&A box you'll see in front of you. At any point during my remarks, please type in questions. We as a group, presenters and Anna and Courtney, will keep an eye on the Q&A, and we'll try to address everyone's questions. And I really encourage you to chime in with comments and questions, and that's what makes this webinar thing, which can be a little bit of a passive experience on your end and a little bit two-dimensional. It helps to bring a third dimension if you guys come in with your questions and comments. So I hope that you do. Okay, I guess we can pull the poll. It sounds like almost everyone has at least a little familiarity, and I look forward to introducing this lens and angle on the field to you all. So about my remarks in my portion of the webinar, I'm going to talk a little bit about a few different angles in looking at our field and on youth substance use. And I think we all come to the work. It's hard for us not to see the world through our own eyes and through our own job description and the way that our experience has taught us to work with young people. And the thing that I'm going to do in my section, rather than to tell you just about what best practice is or tell you what we think is the direction to go in the field, is to step back a couple of steps and speak with broader brushstrokes about some of the concepts that I think are the underpinnings of the way we see the world and the way we practice that we sometimes don't have time or the luxury to step back and look at. So what are the big organizational lenses that we use to understand the world, to develop programs, to see the people in front of us? So I'm going to talk a little bit about public health as one of those lenses, a multi-systems perspective, which many people understand that the young people that we work with, I see there are, and the folks who chimed in and introduced themselves in the chat, there are a number of probation officers, there are folks who work directly with young people in the courts, outside of the courts. Some people identified themselves as members of the community, which is excellent to see people coming in and with just an interest from a community perspective, and that's a role and a perspective we often don't know as policymakers and program developers, that we often don't know how to be inclusive of members of the community in real ways. So the other lens is just an understanding that the community consists of a number of systems that intersect with each other and interact or don't. You hear a lot of folks talk about silos in our work where people just kind of stay in their lane and don't collaborate or communicate well or adopt the perspectives of other people. Clinicians famously don't understand why probation officers think and act a certain way, and probation officers famously don't really get why therapists think about and talk about the young people the way that they do. And so to think about how systems can come together, and that's been one of the major efforts of Reclaiming Futures, is to think of our work in terms of the way that the ecology of all the systems come together to support young people and bring about wellness and justice. And then to talk about the importance of culture and community. And as we know, the purpose we're here for is to talk about tribal communities and tribal youth and the way that we can braid an understanding of the power of culture and the issues facing tribal communities in bringing about positive public health and wellness outcomes. And so to use that as a third lens to look at the work through. And then to talk a little bit about the field in general and how the field of adolescent treatment has been evolving over time. I've been lucky enough to be in the field for 25, 30 years and seen some dramatic shifts and increases in the knowledge base and the options and strategies and just ways of thinking about young people just in the short time that I've been in the field, and to talk a little bit about some of the milestones and kind of key turning points in the history of adolescent treatment. And then we'll mention, and not as a spokesperson or a promoter of any of the models I'll talk about, but just to mention a number of promising and interesting practices that are either focused on tribal young people or other cultural groups, and just to expose you to the names and a little bit of information of some of these kind of innovative projects that if you're interested, I think you'll have my contact information, and we can communicate after the webinar at any point if any of this stuff interests you to discuss further. So to start with, I want to dig in and talk a little bit about public health and what we mean by public health. And I always think that it's best to represent the notion of public health as a circle or a wheel of interconnected kind of elements that start with, and there's really no starting point here. And one interesting thing to note is that depending on your role and what you do, you might immediately, your eyes might gravitate toward one part of this diagram, this circle. If you're a treatment provider, your eye may go to treatment, and for you that may be the starting place where you interact with young people at the point that they need treatment. If you're an intake person, you may look at screening and assessment as the starting point. But really, if you look at society, one way that we like to think about this is how do we define what's okay and what's healthy and what's normal? And these are definitions that change over time. If we were only exposed to the fairly dramatic statistics that Courtney and Anna talked about earlier on, one might have the impression that the norms in Indian country are for significant suicidality and the negative impacts of trauma, the use of substances as almost ubiquitous, and it paints a kind of a normative picture that skews the ideals potentially of that culture, which are really much more toward healing and wellness and health. But the norms are very important, and norms are in the eye of the beholder, and norms are not the same for every culture. So what we talk a lot about at Reclaiming Futures and in our work is to think about what are you personally and culturally bringing to the table when you look at a person and decide where this person stands vis-a-vis your understanding of what is normal. And your normal is not my normal, and that starting point can really set the dominoes falling in your work with a young person if your first impression of them is that this kid is not normal. This doesn't fit my definition of a high-functioning, good kid who is connected to society and not doing wrong. So norms are critically important in a public health sense. Another important element that I want to highlight and that we'll touch on throughout the rest of this conversation is this notion of what is called in the field of public health the social determinants of health. And it's kind of a wonky term, but what it really means are the things in your community and your culture that exist to keep people healthy and well. It may be the tradition of how we take care of each other's young and share responsibility for taking care of babies, that it's a community practice, that it's not just on a single mom to take care of a baby, but that relatives and neighbors are invited to take part in the care of a baby. That's a social and community element, a cultural element that helps to determine positive outcomes for young people. The ways that we construct what we think of as a good diet, that's a social determinant of health. The way we communicate about that, of like, you know, this is what a meal should consist of, or this is how people should support each other. All the things that are somewhat unspoken and often invisible elements of society and culture that keep people well, and that you often don't notice until they break down, until, say, a family comes to you as a judge or as a probation officer, and you can see that they're not able to take care of each other the way that they would like to. And so the social determinants of wellness, while they're woven into the fabric of a community, become very obvious at the person level or the family level or the case level when something goes wrong. Prevention is another one of those things which can be invisible but can also be really intentional. You sometimes drive down the highway and you see a billboard that encourages people to get a cancer screening, or a campaign in the school to be aware of smoking as a hazardous thing to do. So communication and the way that a community organizes itself around messaging and what's okay and what's not okay is an important part of community wellness and public health. And it's very salient to the discussion of drug use and substance use in young people. You look at suburban communities where And this feeds back to our notion of what's normal and norms. You often hear suburban communities say that, oh, it's okay if my young person drinks as long as he drinks in my house. I let them have parties as long as I know they're here and they're safe and there's a designated driver. And someone else might say that that's absolutely absurd, that this attitude, these norms, are actually putting young people at risk and normalizing something which can be somewhat dangerous for them. So all of these things kind of hang together. And then the rest of this circle is probably more familiar if you're in the treatment system and or in the youth justice systems, where we do a lot of these activities, where we do screening. We ask a few questions to raise red flags to see who might need a further assessment. And then we do triage. We say, okay, this is an emergency. We have to get this kid into a residential treatment facility. This person has overdosed, it's an emergency, or this is someone who's at the beginning stages of experimentation. We're worried but not that worried, and I think we can triage this person into outpatient treatment. So the public health wheel here is really how we organize our response to unwellness and how we promote wellness, and it's an important lens to hold in mind. Another thing about the public health perspective, which is not here on this particular illustration, is how we understand populations and the way that we collect information and data. And back to the presentation that Courtney made earlier, is how do we understand the community health, and what statistics do we use to determine where to channel resources and how to build programs. And so understanding, for example, as we did in our work with the UROC community beginning a couple years ago, that they were in the middle of a suicide epidemic among young people, that they were keeping statistics and realized that the high frequency and number of suicide attempts and successful suicides led them to, in an emergency, kind of a state of tribal emergency, to rebuild public health policies around this particular statistic because they were measuring and tracking this data. So it's not here on the chart, but also the way that we track and understand our population trends in our own communities, big or small, are also very important. The second lens that I want to superimpose on the public health understanding of youth substance use is all the systems that sometimes people refer to as the youth serving systems. And some in this diagram are much broader. As you can see, the biggest circle is the community, and all of the other things are kind of embedded within community. Schools, healthcare and treatment systems, the youth justice system, and child welfare. And so what's important here is that when thinking about something like youth substance use, to situate, where do we situate treatment, and where do we situate screening and assessment, and where does most of the action happen? Where does the treatment happen? Where is it that we first notice young people? And not that there is an ideal community, but I think in a healthy and well-functioning community, there is a certain degree of, all of the pieces that I illustrated here in the public health wheel that function in each of these settings. That things like a transparent discussion of norms happens in all of these places. Noticing, and I sometimes like to say, rather than using the term screening, is to use the much more generic and evocative term noticing. Like it's how do we notice the early signs of something? And is it a teacher in school that first notices that somebody is really sleepy in class or is not showing up at a certain frequency and has been truant or not coming to school? Do we first notice somebody when they show up in court in a youth justice setting? And it's like, gosh, we didn't know this kid was, heavily using substances or getting involved in violent incidents. We didn't notice until they got to youth justice. So one question to ask when using this multi-system lens is, are any of these domains over or under functioning in its public health role? And one could easily argue, as I'll talk a little bit about in a minute, that youth justice systems have begun in some ways to overfunction as a kind of a secondary public health system for some communities or parts of communities, that they've become kind of a treatment setting of last resort because in schools and in communities and and because the healthcare systems in those communities have been unfunded or underfunded or are offered in ways that are not culturally prideful. I have heard examples of United Indian Health Services not being a comfortable place for some communities to access services. So how is it that something like youth justice has arrived in society as a place of treatment and a place of wellness, as it really has at this time in our history? And how do we understand that both in terms of a public health issue and also how systems may or may not be collaborating, communicating, or functioning properly? And thirdly, the third lens I want to talk about is the cultural lens, which I think is of critical importance in tribal communities, where some of the factors in this four-part chart here that I'm showing you are often not even considered in discussions of public health or response to treatment need in non-tribal settings. The notion of spirituality and the importance of spirituality, both to culture and as part and parcel to achieving wellness and wholeness, and in the transition from adolescence to adulthood. And as in the same way that we develop physically, we also develop spiritually. This is not something that is talked about in Western communities and in Western public health models. As Anna mentioned earlier, justice practices, which are the set of values that lead to social and other kinds of justice in a tribal community, may be at odds with other jurisdictions that they're embedded within. The state and county and federal justice practices may be directly at odds with or require some kind of retrofitting or workarounds so that it is culturally satisfying, and very often it is not. And a lot of communities where I've worked, just the basic issue of who has jurisdiction over our young people when they do something to get in hot water, and are we able to, empowered to use our own cultural notions of justice in order to help this young person. And the same is true of wellness. And what is our definition of wellness, and who decides who's well and who's normal, and whose responsibility is it to take care of a person particularly when they are both unwell, using substances perhaps, and have done something legally wrong. Whose responsibility is it at that moment to help in the wellness process? And that's where the Healing to Wellness courts have been a tremendous innovation and an important thing for tribal communities and for all of us to learn from. And also history and the fact that all of us, I have 4 grandparents who came from 4 different countries to come to the United States. 3 of them on boats came through Ellis Island in New York. Is how does your culture function in the context of the dominant culture? And it's in every instance a story of both oppression and dishonoring and abuse, and hopefully at times an honoring and a flourishing, and unfortunately most often not in tribal communities. So, having talked about the 3 lenses, I wanted to represent them together, which is really, there are more lenses than just 3, and we've just chosen to kind of look at these 3, that they function at the same time, and they function at the same time in the same person. You're the intake worker who meets a young person for the first time, and you are looking at this young person through the lens of your culture, of their culture, of the systems that you may know are at your disposal and you can lean on or at odds with you, and you may know something about the larger community that this young person comes from. So you come at this with a set of assumptions, but also a clarity that comes from thinking about all 3 of these lenses at the same time. And you can see that they all intersect in the middle, and in a perfect moment where these things come together, the greatest clarity in looking at a young person and looking with a young person at the future that they have is a process of seeing clearly through these 3 lenses at the same time. And it's easy to create imbalance if you don't sort of examine and open your heart to understanding where a young person comes from, and you rely too heavily on one lens. For example, I am mostly concerned with what this kid did to get arrested. It's the 3rd time, and it makes it hard for me, say as a probation officer or a judge, to see how this person fits into his larger community from a public health standpoint, that he may be part of a trend. And should I be thinking, wow, how do I get upstream of this and think about how to prevent this from happening in the future, versus I am fixated on my own lens because I'm working within this particular system, and how much do I trust and open up a collaborative relationship with members of the culture to put this person on a path toward wellness that includes reconnecting with cultural elements or other people in the community other than the main players that usually get mobilized when a kid gets in trouble or needs treatment. So just a few to shift gears and talk a little bit about just some key observations about how the field of adolescent treatment has unfolded since the late 90s. And I'm gonna use the late 90s as kind of a starting point for me for this conversation, because it's also relevant for me. It's right around the time that I entered the part of the field after I finished my graduate education. I suddenly found myself working in a juvenile justice setting and realizing that the field was kind of in an infancy and beginning to try to sort out what is adolescent treatment. And until the late 1990s, there really wasn't a well-developed field of adolescent treatment. There weren't evidence-based models. There wasn't a well-articulated kind of approach and an understanding of the complexity of what it means to work with adolescents and what they need to really succeed. And it seems maybe surprising to many of us now, given the resources that we have and kind of our heightened awareness of adolescent development, that this was the case. But we were putting kids in AA groups along with adults. And so the field was really kind of getting itself off the ground. Another interesting observation is that the evidence-based treatment approaches that are most prevalent and most supported in government RFPs and are promoted, the most well-developed and manualized evidence-based approaches, did not emerge from community clinics, from community settings. They emerged in kind of sort of well-funded, government-funded laboratory kind of settings from academia. And it wasn't a natural development like, say, in medicine where, medical practice slowly unfolded over time and sort of the field changed along with the technology. In adolescent treatment, a lot of the best practice and evidence-based approaches kind of came from above and were dropped down into the community. And another interesting fact is that the funding for that and the environment for that kind of innovation laboratory period in our history of our field really happened in the context of juvenile justice, so that a lot of the clients were kind of a captive audience, no pun intended, and so the communities and the population and all of the funding and the grant funding that kind of drove the innovation and the building of evidence-based practices also didn't happen in communities as well. Another observation is that in many communities, juvenile justice systems, and often the courts themselves, are the primary referrer in that community to substance use services. And often the primary funder and or staffer of substance use teams that work with young people. And it's an interesting, I talked about it earlier, how juvenile justice has kind of rebuilt itself, thankfully, from a period where it was much more incarcerative and punitive, but it's rebuilt itself around the notion that its primary role is to assess and provide treatment to young people. So all of this is kind of leads you to wonder, so where is the community in all of this? If kids in a community are most likely to get good treatment or evidence-based treatment by getting in trouble with the law, what does that say about public health, about prevention, about the availability of the kind of natural noticing and triage and healthcare options in the community that provide the natural off-ramps from systems that, without getting too strident and on a soapbox, really what business does juvenile justice have to be the primary purveyor of wellness and health in a community? And should it be more balanced, and should it be over-functioning? So again, to talk a little bit about how juvenile justice became the laboratory for the development of evidence-based practices, and I intentionally, in this third bullet down here, put this kind of alphabet soup to show you how many models have been created. I'll tell you what these mean. MST, as many of you know, is multisystemic therapy. Then you have multidimensional family therapy, functional family therapy, brief strategic family therapy, multidimensional treatment foster care, adolescent portable therapy, motivational enhancement treatment, and CBT is cognitive behavior therapy. ACRA is the adolescent community reinforcement approach. 7 Challenges is a great developmental model of addressing substance use that has some great evidence behind it. But all of these models were really developed in juvenile justice settings, and you can't really find them in a clinic in your community. If you're a mom worried about your young person who you see they're using drugs and you're worried and would like to get them into treatment, it's very difficult to find what the consensus has been nationally that these are the models you ought to look for. They don't exist in clinics really, and they have to be accessed in some ways through this secondary public health front door, which is youth justice or child welfare in some instances. So what does it mean for communities and just for the field that adolescent treatment evolved in the way that it did? That it was very academic and federally grant funded, focused on juvenile justice populations. One of the things that occurred from this is that community-based clinics have had a really hard time implementing and sustaining these practices when they have been invited to take part in an implementation or have been part of a grant or have decided to try to adopt an evidence-based practice. Because there was no organic development from the kinds of things that community clinics do well and did well historically, the way they were staffed and organized, as community clinics, created a kind of a disconnect, and it was very difficult to suddenly staff up in order to do one of these evidence-based models. And very often, and this has been one of the challenges of federally driven and even foundation-driven initiatives to fund the adoption of evidence-based practices, is that when the money is gone at the end of a grant, communities tend to revert back to what is comfortable for them in the community. And it doesn't mean that it's comfortable and wrong and or outdated, but it may be that they revert back to what the community is actually telling them they need, or what is natural for the kind of workforce that they have. But one of the universal things that's been observed in the field is that at the end of a grant, evidence-based practices tend to float away. Another important thing that has resulted from the way that these models have been built is that they weren't necessarily built with the notion of adaptation in mind. Most of you have heard that in order to succeed with an evidence-based practice, you need to practice it with intense fidelity and very close training and adherence to a manual, when in fact in the real world, and I think the world has kind of come to understand this a little bit more, the field that is, that in order for things to be sustained and successful in communities, they need to be adapted in certain ways and made to fit in communities. And I think that an initial obsession in a way with fidelity really is one of the things that made it difficult for community settings to really successfully adopt and sustain practices. And also on the note of adaptation, definitely initially, and really not enough examples are really out there now, evidence-based practices have neither been adapted to different cultural communities, for tribal communities, for young people of color in urban settings, for Latino populations. They were really not created with cultural variation and the importance of culture and the power of culture in defining a treatment process or a wellness process. They were really not created with that in mind, and it's been a little bit of a square peg in a round hole, and research is bearing that out, that a lot of traditional and very rigidly applied evidence-based practices are often alienating to folks who are not from the dominant culture. So even though I promised not to just simply promote particular practices, I do want to talk about what the field has kind of taught us and what the research has shown, and what the practice itself has surfaced in terms of what is engaging for young people and what leads to good treatment engagement and family engagement and outcomes from a research standpoint. But these are some of the key building blocks that the field has reached consensus about for what is good adolescent treatment. If 20 years ago there wasn't a field of adolescent treatment, now I think we have a fairly strong understanding that focusing on skill building is very important, that adolescents are in a rapid process of acquiring real-world skills. And so programs like cognitive behavior therapy and ACRA, which I mentioned is the Adolescent Community Reinforcement Approach, those are very skill building and cognitively focused programs with decent outcomes, and those have surfaced as positive ways to work with young people. Strength-based approaches, meaning non-pathologizing. I mean, adults are able to say, my life is in ruins, I've hit bottom, the doctor told me I'm at this, this point where I really need to take urgent action in terms of treatment. And adolescents do not respond well to an authoritarian message in terms of motivation. And so using motivational interviewing and strength-based approaches has been critical to success with adolescents. The research on adolescent treatment models shows that you get a significant additional margin in terms of outcomes to the degree that you can authentically engage families in the process, or just focus on family therapy and not put the sole burden of change on the young person. And there have been some excellent adaptations, and I'll mention a few later, of existing evidence-based practices for tribal youth. And at Oklahoma University Health Sciences Center in Dee Bigfoot's group, her work around trauma and adapting existing models to make them relevant and resonant for tribal communities has been a really important driver of good outcomes for tribal young people. There have been some exciting new evidence-based programs that have been developed and tested from the community for diverse populations. I'll just mention a few in a second. And then finally, approaches that really are not, you wouldn't know they were treatment, and the young person referred to a program like this wouldn't know they were in treatment if they were in one of these, but really they do contain significant transformative elements. They promote positive development and are healing in nature programs which are about theater arts. A program that I helped to start in New York City called Stargate, which is a theater company for formerly incarcerated young people. There are really excellent programs that function around sports. An example, this Phoenix Multisport is a treatment recovery organization that delivers all of its message, its activities, and its treatment through team-based sports, both in incarceration settings and in the community. It's showing great promise. Some sites for in the Job Corps, most of you have heard of Job Corps. It's a residential vocational training program for kids who are probably not college bound and often can get their GED while they're in Job Corps. There are some sites in Job Corps that are weaving brief substance use treatment right into the Job Corps training so that it doesn't either interrupt or make a young person ineligible for Job Corps, but is part and parcel to the training that they get about substance avoidance and awareness. And so that's been pretty exciting for years. Testing positive for any drug was an immediate rule out for your eligibility for Job Corps if you were a young person who wanted to get into Job Corps. And there are some really successful pilot sites now of not having that as an exclusion criteria, but having it be part of the curriculum itself. It's pretty exciting. And it looks like I'm a little bit over time. So just to mention a couple of exciting new programs, which again, feel free to reach out to me if any of these interest you, and I can connect you personally with the leadership of these programs or get you more information. But clearly we talked about the evidence-based practice adaptations by the Indian Country Child Trauma Center. Assessment tools, which are driven by cultural concepts and by the youth themselves. There's a tool called the Youth Balance Assessment that Jamie Barchis worked with the Youth Council at the Fresno American Indian group to create. These youth created their own assessment tool, which is really exciting and powerful. Daryl Turpin, who is a psychologist who works in juvenile justice settings, has created something he calls the HEAT program, which is specifically around for African-American men young men dealing with the transition from youth into manhood, and they have some good evidence behind them. They're they're now considered an evidence-based program. Jerry Teo's Compadres Network. The RISE program in Oakland, which is led by Kanwarpal Dhaliwal, is a community-driven trauma-informed program where the community itself assesses and defines the community trauma and comes up with healing solutions, as opposed to someone else doing an assessment and telling you you've been traumatized. It's a really exciting grassroots community-based approach to trauma and healing in communities. EBP Plus is a consortium of about 12 different organizations who have come together to try to build a new set of evidence-based practices specifically for non-white youth. We'll talk for a second about Reclaiming Futures has been doing tribal adaptations of something called SBIRT, which is Screening, Brief Intervention, and Referral to Treatment, which is in that early part of the public health wheel around how do you screen and triage and motivate somebody to get treatment, but to do it in a culturally resonant way. And so we've been working with tribes to create their own SBIRT models. And of course, the big example, and one of the most powerful examples, is the Tribal Healing to Wellness Courts. So I think, Courtney and Anna, I think I've gone over time, so what I think I'm going to do is just zip ahead to just leave you back with this graphic to remind you to think about these multiple lenses when you look at the work, and to think about where you come from and which system is your dominant lens, and to both look for practices but also look within your own heart to think more broadly about the community that young people come from and the impact of braiding culture into your understanding and the way that you respond to them, and the importance of collaborating across systems and expanding your own lens through collaboration and not living just in a silo. So I will leave it there and hope that there are questions later, and we'll pass it on to our next presenter.
Okay, great. Thank you. Thank you, Evan. Did we, I have in my notes that we have a poll. Okay, well, thank you, Evan. And, you know, I think we're still doing pretty good on time. So as we hear from our next speaker at the end, if you have any questions for Evan or our next speaker, please contribute them, ask them in the Q&A box, or even the chat. We'll keep an eye there, but for sure they will not get lost in the Q&A box. Thank you for those questions that have already been submitted, and we will get to those. And but right now what we wanted to do is I wanted to take some time and introduce our next speaker, Mr. Cipriano Lucario. He is Dene and Sicilian, and he's a Tribal Action Plan and Wellness Coordinator. So Mr. Lucario earned his bachelor's in public administration from San Diego State University in 1999 and master's in counseling psychology at the California School of Professional Psychology in 2001. He said he was born and raised in San Francisco, California, and spent summers with his grandparents in Tohatchi, New Mexico, and throughout the Navajo Reservation. Mr. Lucario has dedicated 15 years of professional development to work with American Indian youth throughout the state of California, within multiple levels of incarceration, community mental health centers, higher education institutions, and reservation communities. In addition to providing direct clinical services, Mr. Lucario has worked within various youth-serving agencies to bring about systematic change to improve the behavioral health care for Native youth in California. Mr. Lucario worked at the National Indian Health Board, where his focus was identifying and developing best practices with tribal communities and assisting in the support of education for and with American Indian Alaska Native Health. Mr. Lucario currently works as a Training and Technical Assistance Coordinator supporting the SAMHSA Tribal Training and Technical Assistance Center TTA efforts across Indian country. We are happy to welcome Mr. Cipriano Lucario, who's going to share a little bit about the SAMHSA Tribal Training and Technical Assistance Center, what they do, what they offer, and the resources available. So at this time, I'm going to turn it over to Cipriano. Welcome.
Thank you. I don't think I've heard my name so many times in one paragraph in a while. Thank you, Courtney. thank you to the OJJDP and obviously the Indian Child Trauma Center for the opportunity to contribute to your guys' very important work. Thank you to Evan for really laying the foundation and lining up the pins so I could knock them down the best I can, and just thank you for everybody on the call for taking a little bit of time out of your important work in your day to contribute to proactive thinking for the wellness of our tribal citizens. When we started this conversation, you guys really talked about the complexity of the juvenile justice system and what we know, and definitely from the SAMHSA side and the prevention side, we often see that prevention services are kind of piecemealed together across many siloed resources, federal grants, state opportunities, foundation support. And this really creates various departments and fluctuating topics that our prevention services gravitate towards or complete. And a lot of these outcomes are defined outcomes that are grant related. And so, you know, as we kind of talked about, how do we do this important work, and how do we really think about the opportunities of creating a system of care? And I appreciate it, you guys really looking at, I think it was referred to as the role of the interconnected system. And one of the things that I always like about the English language is I find new ways to say some of the exact same things. So in SAMHSA, for anybody in the behavioral health field, and I know that the juvenile justice side of it, the role of the interconnected system is oftentimes referred to as a system of care philosophy or framework. So in case you heard me saying system of care philosophy, it's really referring to that interconnected system. And through my work with SAMHSA and supporting federal initiatives from Washington, D.C., I learned two things. One, if Indian country is not at the table, we're on the menu. And the second thing is that each federal administration, every federal program has their own culture and their own use of the English language and their own acronyms. So I'll do my very best to kind of translate the process of what we're learning from SAMHSA and integrate it with what you guys are working through with the OJJDP effort and obviously with the Indian Child Trauma Center and their TTA supports. But speaking that common language, how do we develop and speak a common language across the professional experiences is something that we see. And so if anybody's unfamiliar with the system of care philosophy, I really push you to really think about it. And it's just, again, it's an interconnected system, but it's family driven, it's youth guided, it's community based. And it's really looking at, is the system of care support the framework culturally and linguistically competent? And a lot of times when I work with tribal communities, you know, I get a lot of opportunities to support strategic planning efforts. And one elder always told me, what good is a strategic plan if our grandmothers can't read the plan? And it's very interesting because a lot of the work supporting our children in our tribal communities really relies and leans upon our elders in the community, our extended family networks. And so how are we really thinking about bringing everybody to the table to think about how we change our community, how we mobilize the community, how we support our family, or how we support our young people? And I'll just share a little bit about myself. I come from a mixed family, being Navajo and Sicilian. We have Christians, we have Catholics, we have Jehovah's Witnesses, we have atheists, we have very traditional Dene people. So how do you have a funeral? How do you have a wedding? How do you celebrate a birthday? These are all challenges on a micro level that for our tribal communities, and especially in the professional fields, how do we work across the system? And how do we make sure that everybody feels that their voice is heard in the system? And how do we bring common goals and collective opportunities from across the system to help a tribal nation mobilize its efforts for their tribal citizens? And so those are the things that I have the opportunity of learning, and I am going to take an approach. I know that we hear this story all the time in tribal communities, three sisters walking up to the river and seeing babies floating by. One sister jumps right in and saves one baby at a time. One sister grabs a tree branch and tries to push babies to the shoreline, and one sister takes off running uphill. So I'm going to try to tackle my brief 15 minutes to think about each of those three sisters, because each of those three sisters need some support, need some guidance, and need resources in order to think about their important work to get ahead of the challenges, to collaborate across the challenges, and to be in the trenches, saving people in the trenches, facing the challenges. And so with that, we do work at the Tribal Training and Technical Assistance Center And this is our TA website. And we provide training and technical assistance to anybody serving American Indian Alaska Native people. They do not need to be a SAMHSA grantee in order to receive services. We have these different categories right here, and we support tribal action planning. And the Tribal Action Plan, the Tribal Law and Order Act, is actually going to kickstart the systemic opportunities tribes have in considering developing a system of care for their tribal citizens and their families. But on our website here, I'll be referring to different theories, different philosophies, or different codes of work. And in our webinar series, you'll see these 4 topics. And if you clicked on any of these, you will get an array of different webinars that we have done, some tackling current issues, some pushing for proactive strength-based changes, and some really looking at our families. Instead of having suicide prevention efforts, how are we celebrating our families and thinking about the power of language and how the power of language can shape the way that we celebrate successes in our community versus overcoming the deficit perspectives. And so this is a little bit about our website in regards to our support with and for SAMHSA through our training and technical assistance efforts. But when we think about opportunities for tribes to look at the tribal youth and substance abuse challenges and thinking about how do we support or how do we assist our tribal nations looking at strengths and the needs of their community, one of the biggest opportunities that we see right now is the Tribal Law and Order Act, referred to as TLOA. So that's the acronym I'll be using, TLOA. And the number one place SAMHSA puts out their information on the Tribal Law and Order Act, or TLOA, is if you Google samhsa.tloa. And why this is a pretty amazing perspective, and with the Department of Justice being a very key support and ally for SAMHSA, is the Tribal Law and Order Act really brings together multiple federal partners to think about prevention, support, and services around substance abuse challenges facing tribal nations and communities. And so this collective federal partnership meets once a month, where they have meetings and they discuss the opportunities that each of their administrations are serving, and they support outreach. They support resource development. They support training and technical assistance. And so there is these meetings all the time amongst these different departments across the system, and each of these partners are providing support implementing Tribal Law and Order Act. But just like we said, every federal system has their own culture and their own language. Sometimes the dots across this law are not easy to connect. And some tribes on the call, you probably are very familiar with this. And how do we support transparency? How do we assist the federal government aligning with its federal partners to consult with a tribe who might have a tribal action plan that supports the development of a system of care for their tribal citizens, tribal families, or within their tribal infrastructure? So this is a little bit about the partnership, and this is where they really get out a lot of their information. For anybody who's unfamiliar with tribal action plans, these 2 documents right here will give you the 30,000-foot overview, the TAP guidelines and the TAP frequently asked questions. I always use this as kind of the starting place of where to get information. What is this all about? There's a lot of online resources, but then as you could see, and once your tribe might consider a tribal action plan, or if there is already a strategic plan that is driving the prevention care system, then how do you maximize the use of that plan to get multi-federal agency support for the implementation of that plan versus a single agency support if that plan is submitted to their federal funded partner. So in this Tribal Action Plan portal, you see funding opportunities, training and technical assistance, partners and foundations, publications, and resources. And again, this is one of the main ways that SAMHSA is getting out their information. The office that oversees the Tribal Law and Order Act and supports the herding of the federal partners is the Office of Tribal Affairs and Policy. This is one of the highest offices in SAMHSA. They support a lot of the advisory committee meetings that when tribal leaders come to Washington, D.C., this is the office that really supports agenda development. They're the first line of support for tribes. They are located in the Fisher Lane building, which is the same building that IHS and other federal partners are in, and they support a lot of the TLOA implementation. They are overseeing the guidance and support of all the federal agencies And we always share that, for any tribe who has any questions with SAMHSA and support, I would definitely link this in, because this office is really here to support the voice and the listening to Indian country. In this work with the Tribal Law and Order Act, one of the things that we've been pushing SAMHSA really to consider, and we're very thankful that the development of this new website came out, and anybody who's unfamiliar with this is the Knowledge Network under SAMHSA. And I've been in the Washington, D.C. for the last 7 years, and, technical assistance. The framework of TA, or training and technical assistance in Indian country, varies, and within SAMHSA it's all across the board as well. This is a website that brings together all of the TA centers, the technical assistance centers, and technical assistance is different than grants management. Your project officers, I don't know what they're called in the Department of Justice, but in SAMHSA they're called project officers, or your core. They are the guiding informant around how a grant will be managed. Now, many of SAMHSA funding streams, and just like the Indian Child Country, is a training and technical assistance connected to certain areas of a funding stream. Now, the services and support they can provide go beyond just grants management. And for these TA centers, these are the topics and these are the focus of these TA efforts under SAMHSA. So if a tribe developed a state of emergency due, let's just say, opioid abuse, we know that opioids are very systemic in nature. You have the prevention side, you have the treatment side, you have the military vets and the family side, you have the elders community, you have all the different point of contacts that a tribe can initiate in order to reduce the overall impact of opioid abuse. Well, unfortunately, some of the TA centers are siloed in nature as well. So how does a tribe get technical assistance for multiple TA centers at once versus one by one, which historically has been done, especially when we think about suicide prevention for our young people, suicide training for our community members, suicide support for our first responders who might need some self-care efforts. So the list goes on and on about how do we integrate technical assistance within our funding streams, because just like was said, maybe after the funding stream, the program is gone, but some of those lessons learned within the project that resonate with communities can stick. And so the training and technical assistance efforts could be kind of the resonating places for things that should be considered things that would stick. So as you could see here, these are Administration of Children and Families. These are all of the technical assistance centers online. IHS is in here. And so this is the one way that SAMHSA is trying to implement components of the Tribal Law and Order Act. But really, one thing we hear from tribal leaders is this is an unfunded mandate. And there is not a lot of funds directly related to tribes who should consider or could consider the opportunities of a tribal action plan, but there are a lot of training and technical assistance efforts to be aligned. So we're still learning from tribes. I know that there's some representatives here on the call today with us where their tribes are working through the development of a tribal action plan, and we're really pushing for consideration on, once calls are initiated, how can tribes have a good understanding of the system so they can be more proactive in requesting targeted TA versus just responding to kind of darts that are thrown to see what sticks. And so this is a great place to come. I would definitely look at this SAMHSA's Knowledge Network, and the website will be knowledge.samhsa.gov. Another website I would like to show you in regards to some models that we're seeing, community mobilization. Now, the Tribal Law and Order Act is really tribal leadership, health directors, the legislative team to kind of look at, what's something that we could do on the policy level to align, coordinate, and the system of care framework really highlights some core values that we know really resonate with Indian country as a whole. But when you think about community mobilization, getting into the community and kind of understanding the community readiness model is one that we're seeing here. And if anybody's unfamiliar with these stages of community readiness, and I use this around treatment all the time, and I love Barb and Pam's perspective. If a tribe gets a substance abuse treatment grant, the number one thing we do is hire a substance abuse counselor. But if the community is in denial that there's a substance abuse problem, then that counselor's office is going to sit empty for 50 weeks out of the year. So how can tribes really look at matching the level of readiness to the introduction of new opportunities or new resources to raise the level of readiness for the field of prevention or healing in our tribal communities and tribal families. So the community readiness is a low-tech, low-cost way, tribe-developed, tribal-specific way to look at identifying starting points for opportunities. And we're looking at using the community readiness to really think about our strategic planning efforts. How ready is our communities to cross-collaborate? And there's all kinds of cool things that are in there. If anybody's unfamiliar with the community readiness, this is a tremendous model that really looks at these dimensions of knowledge of community efforts, currently what's going on with community efforts, what is the knowledge of leaderships on the issues, what's the community climate on certain issues, the community knowledge about the issues, and what are the resources related to the issue. And so by understanding your level of readiness can really look at the opportunity of going in and making a bigger impact with the limited amount of resources we do see. It's kind of like somebody knowing their credit score before they go to the car lot, so they could kind of know exactly what kind of car price range they're technically in. This website right here, though, this Community Health and Development website, actually lists a couple different community mobilization. This is a strategic prevention framework. Here, this SPIF is referred to in the projects. This is a great model, really looking at some of those same things, the public health model. I'm a fan of the public health model, but then yet I know that the public health model has its challenges, and those challenges don't always resonate or connect with the strengths or the hope that Indian country looks at around resiliency factors. But the SPIF does, they have the same challenges as well. And another one on here that we're seeing work for tribes it's called MAPS, Mobilizing for Action Through Planning and Partnerships. As you can see here, this website links all three frameworks on the website. This is a great starting point for any tribe who's looking at opportunities of community mobilization around these efforts. Out here, this is a website around the Department of Justice and the Tribal Law and Order Act. And again, some of you guys are probably real familiar with this website. This is the CTASC, and the CTASC website. And if you click over here on the training and technical assistance efforts, again, how can SAMHSA support collective conversations with your federal funded training and technical assistance centers? We have the opportunity, and we reach out to Justine Soto and the Fox Valley Technical College. They do a tremendous amount of support and work on behalf of DOJ. We're very thankful for the opportunity to collaborate with them. But, how do we have conversations across professional silos? How can behavioral health, public safety, education have collective conversations at the same time? And that could be linked through the TA centers, building relationships across the TA centers, which is a goal of ours, and personal relationships like Courtney and Nick. We're just thankful for the opportunity to support you guys in this important work. But really thinking about how do we collectively have conversations across the silos so we don't stress out the tribal prevention services with multiple meetings or multiple trainings or multiple site visits. Having collective conversations, deeper conversations at the same time has really led to some more opportunities of us supporting tribes on a deeper level, especially in the strategic prevention field. With that, one of the partners is the Bureau of Justice Assistance. And again, for SAMHSA, SAMHSA is kind of the guiding agency for these federal partners. So when we get opportunities to work on tribal action plans for tribes and with tribes, really thinking about the training and technical center system. And so this is where I'm pulling a lot of information. But for tribes who have BJA funding and looking at the opportunity of getting training and technical assistance, you can see here, this is where they're linked to all their training and technical assistance supports. Primarily virtual webinars is the way to go, but some TA centers provide on-site TA efforts. And if they're really good, they'll work with understanding the importance of what Evan referred to in the beginning of this webinar. How do you bring in the culture piece of it? Here is the IHS effort, and this is what else we're seeing. And so I know I'm coming up real brief on the timeline, but I wanted to get down to the local level. This is community mobilization. This is what we're seeing in tribe healthcare system movements. But on the local level, in the trench level, some things that we've seen really resonated with tribal prevention programs is the 40 developmental assets. And the 40 developmental assets vary besides age range. Obviously, what developmental assets a kid gets from 6 to 10 are different from 10 to 14 and very different from 14 to 18. But as you look at these external and internal assets, these are just great open-ended questions to ask any community. What kind of support do young people have? Do the young people feel empowered? What are the boundaries and expectations? What are the constructive use of times in our communities? What is the commitment to learning in your nation? What are the positive values contributed to culture and tribal perspectives, social competencies, and positive identity? These are some of the big pieces that we're seeing that really resonate in Indian country. This has not been adapted, but these 40 developmental assets really go a long way in thinking about their effort and support for Indian country. I'm going to go back and stop sharing. I know I'm just about, if not over time. I do know that there's a ton of PDFs and fact sheets that we shared, and one of the PDFs that I'll just mention is there is a strength-based, resiliency-focused journal that highlights 13 different projects in Indian country looking at ways to measure strength and resiliency in our tribal nations. There is a big movement in Indian country pushing for that desire, and just like psychology missed the boat with spirituality as a motive to change, and now we see that, we do see strength-based and resiliency focus coming back into the professional silos as optimal ways for communities to help mobilize and push young people to see what's working versus what's not. I mean, we could measure hopelessness or we could try to measure hopefulness. And I really see tribes taking a proactive approach to really thinking about what's working and complementing the deficit-based nature of the data we get from Washington, D.C. With that, I just want to say thank you again, Courtney, and your team for the time. And I'll answer any questions that anybody might have in regards to our support with training and technical assistance. Thank you.
Thank you, Cipriano. Certainly a lot of information, a lot of really good information. Yeah, we're running close up on our time. We had a couple of questions that I wanted to get to. Again, thank you, Cipriano. That was some really great information. I know we saw some chat as well, people wanting slides. And so this webinar will be it is being recorded, and the recording will be sent out. And of course, any questions you can always email, ask myself, the TA Center, or Cipriano. We'll share that contact information so that you will have direct links to us. One of the first questions that we wanted to ask, and I believe, Evan, it was directed to you. And I'm going to go ahead and let you take it because I think you had a sense of what that question was. I'm not able to see it right now. And then after that, the second question by Laura French was directed to you as well, Evan, is the IHS Regional Youth Treatment Centers have been in effect for over 30 years. Okay, so that looks like that was a point there. But I believe there was a question that you saw, and so I'll let you answer that.
Okay, thanks, Courtney. Yeah, I accidentally deleted the question. Apologies for that. I think the question was about whether in defining things like norms or defining need and responses, whether we, in our work, whether we are participatory and collaborative. And I think that hits the nail on the head really with our philosophy, that the whole point of my presentation really is that the nature of how we understand a problem and the solutions that really are the most effective and resonant are the ones that come from within the culture and within the person. In order to know that, you have to sit with the person and listen and walk with that person in a very different way than we do traditionally. That the checklist-oriented screening tool that is trying to ferret out whether a person has experienced a trauma just so we know how to categorize you as a traumatized person is very different than allowing a person on their own terms and in their own time to tell you, and using their own, cultural language and metaphor, and or in their own time, if ever. And so that's why, the program I mentioned about the community-driven trauma healing center it's outside of Oakland, California, is so powerful, is that it's not about assigning just another label and another risk label to a population that we have no end of labels to distance ourselves from, those of us in the field who design these kinds of programs, but really to sit and create as true collaborators with the person in front of you a solution and a definition of their wellness in personal and cultural terms. And that sort of in a nutshell is how we have approached the development of our SBIRT, our Screening, Brief Intervention, and Referral to Treatment, is to start at ground zero with the tribal communities and ask them what are the questions that you would ask in order to know how to support a person, or how to go forward with the healing process. What are red flags for you, and what are positive signs of resilience? And so to define norms and screening and the questions themselves, and define the brief intervention that may or may not lead to therapeutic treatment, but some other intervention, which could be that the community is awakened to the pain that person is and wraps around them in a circle. And so a long-winded answer to your question is our view of this is all participatory if it's to be effective. And then I guess, to Dr. French's comment, I mean, yes, I didn't mean in my comment to minimize the role that IHS regional clinics have played, and I was referring to really a specific experience I had with the Yurok community. And it goes to what Cipriano was saying, is that clinic that has, empty chairs 350 days out of the year because the community itself, not the clients, but the community itself wasn't ready to bring that seat in the clinic or that bed in the clinic to the community, and vice versa. A very underutilized relationship with IHS in the Yurok community in Northern California. And we made efforts to bring them together as a community to discuss that, and to have them working together on the SBIRT project that we brought to them as a way of opening those doors, which were not feeling as though they were open to the most needy community members. So that was really just a specific experience about how the community needs to be ready, and community meaning everyone, including IHS in that setting. So other questions, or I'll bounce it back to you, Courtney.
Thank you, Evan. I'm looking at our time, and I know that we are right at time. So we are going to get ready to transition to wrap up. I know we wanted to hear from our assistant director before we jump off here, and then also invite everyone to take our final webinar survey. But Anna, you had something that you wanted to share?
I did. I first wanted to thank our guests for joining us today. I know that, it's really incredible that we can have a group of us from across the country joining together, even for a short time, and to share a lot of information. We do have follow-up consult available, so if there's questions you have that you weren't able to ask today, please feel free to reach out to us directly. And we are happy to connect you with our guest presenters, and then also follow up with you as a TA center. And then I also wanted to say that on June 19th, we will be doing our second session of this series, and we're going to invite Evan back to speak with us. Then also we'll have another guest. Allison Kelly will be joining us, and we want to talk about evidence-based practices, continue that conversation, but also talk about practice-based evidence and then tribal best practices. So really that concept that the answers do come from within, and that our communities do have the strength and the ability to empower themselves to develop processes that will help our tribal youth. And so we thank all of you today for joining us, for giving us your time, and for allowing us to come into your life and share some things that we think will be helpful and provide your community with some support. So thank you for joining us. We look forward to you joining us again for our second session. And again, if you have questions, comments, please take our survey, and please feel free to reach out to Courtney. His email is at the bottom of the screen, and presenter contact information. Evan's information is there as well, and then Cipriano. So thank you to our guests, and thank you to our participants. We hope you have a good rest of your week.
Yes, thank you for everyone for hanging on with us. And again, if you have any questions, please do not hesitate to reach out. Nick, before we leave, Nick has some direction on how we can take the survey.